Hi, I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry, and I'm coming to you live from the lovely waiting room of our dental practice here right outside of Atlanta. And today I'm going to answer a question that I get asked often, and that is, do I really need this crown? Often patients will say, well, doc, I don't really feel anything. Maybe I'm okay without it. So let's explore this topic and figure it out together. First of all, as I've discussed before in one of my other videos, a crown is an outer covering that goes on your tooth. It can be made of different materials, and you can certainly investigate my other videos to learn more about that. But just the beginning, a crown, outer covering, covers your tooth and protects it. Now, let's go over a couple different scenarios. Situation one, must have, no-brainers. These are situations where 9.9 out of 10 dentists will agree that your tooth should have a crown. One of these, root canal treated molars and premolars. What that is, root canals are when you get the nerve cleaned out your tooth to make your pain go away, but after a root canal is done, your tooth is hollowed out and becomes very brittle. It's weaker than it was before. It can certainly fracture easily. So the normal protocol for back teeth, which are molars and premolars, is to get a crown on them and cover them and make them stronger. Front teeth, sometimes you can get away with a filling, but pretty much all the time, if you have a root canal on a back tooth, you need a crown afterwards. Another scenario, a big chunk of your tooth is broken off. Once again, this is a no-brainer. You should definitely have a crown on this tooth. This tooth has a whole corner of it missing. You cannot fix this with a filling. You need a crown. Now, if it was a little tiny part that's broken off over there, maybe you can have a filling done on that. But when it's a pretty decent size that has broken off, a crown is the proper remedy for it. Something called cracked tooth syndrome. I will have patients come to me and say, Doc, when I bite on something really hard at just the right angle, I feel a little jolt of pain on one of these teeth. Then we do some testing to figure out if you have something called cracked tooth syndrome. This is when your tooth has a crack in it and it's bothering you. You bite down, it splits the crack open a little bit, sends a jolt of pain to the nerve, and the remedy for this is a crown. Now, it could need other stuff, could need a root canal, or if the crack's really bad, the tooth needs to be pulled. But usually we start with a crown because it covers your tooth, and then when you bite down, that crack is no longer splitting open, sending the little jolt of pain to the nerve of your tooth. Final thing, a broken old crown. You usually know if you have a crown and it's broken. And every now and then, if it's really small, maybe we can get away with smoothing it up. But if you have an old crown and you bit down on something and it's broken it, then yeah, you need a new crown. Decay under an old crown. Here's what I mean by that. As I said, the crown is an outer covering that goes on your tooth. The most common area where problems develop is the border of where the crown ends and your tooth begins. You can get food packing there and it can result in a little cavity. This needs a new crown. We've got to cut off your old crown, clean that decay out, make you a new crown that goes on to healthy tooth structure. Rarely, it's almost impossible to get a cavity forming on the top of a crown unless you have a little hole in it. But down here, if you get cavity, yep, you definitely need a new crown in that scenario. So that was situation one, situations where we must have a crown. Now, let's go to situation two. These are scenarios where you would most likely benefit from a crown, but not absolutely must have. In a situation like this, probably 7 out of 10 dentists are going to agree that you would benefit from a crown significantly. And that is something called an asymptomatic crack. When your tooth has an asymptomatic crack, you don't know it's there. It's not like the cracked tooth syndrome where you bite down and it hurts, but the dentist will tell you, hey, you've got a crack on your tooth. So let's go over a couple of these cases. This is a tooth that has a really prominent crack. You see that big black line down there? Yeah, if I had a tooth like this, I'd more than likely want a crown on it, even though it's not hurting me. I've seen enough of these to know that if you have this prominent of a crack on your tooth, it's going to cause you problems in the future, and it's good to cover that tooth up and make it stronger. This is another scenario. Once again, a crack that's prominent. It extends from one side of the tooth to the other. If you have a crack that's going all over your tooth, chances are high that sooner or later this is going to fracture. So most dentists will agree this tooth should have a crown on it. Now, this one's a little different. This has a little crack over here. It's not hurting you. I've seen teeth like this be fine for many years, but I've also seen teeth like this break and cause you serious problems. So this is one where, yeah, you can definitely have a crown on it. It'll definitely make the tooth stronger, but you should definitely know the positives and negatives of doing a crown before you have it on a tooth like this. And I'm going to discuss that a little bit future. So there's differences between the types of cracks. Some cracks, which are painful, those definitely need to have crowns. Of the cracks that are not painful and they're asymptomatic, depends on how prominent of a crack it is. So that's some good information for you there. Now, finally, the third scenario is maybe you would benefit from a crown, but you should know the positives and negatives very well before you start doing this. And the most common case in this scenario is a tooth that has a large old filling in it, but it has no decay, it's not broken, and I don't see any cracks around it. What should you do in this situation? Well, yeah, you can definitely have a crown on this tooth, but if you do have a crown on it, you need to be aware of some positives and negatives that may occur. A tooth like this, just like we discussed before, it may be fine for many years. I've got a lot of old patients, and they've got large old fillings that have been fine for many years. But yeah, if you bit down on something hard at just the right angle, it could theoretically break off because there could be some cracks that we can't see with our naked eyes. So if you're getting a crown on a tooth like this, you should definitely know the positives and negatives. What are the positives? Of course, it will cover your tooth and make it stronger. That's the whole reason we're doing crowns. They go over your tooth and hopefully prevent them from breaking in the future. So goes on top, covers your tooth, and will prevent your tooth from breaking in the future, of course. Aesthetics, yeah, crowns are always usually better looking than your natural teeth, but a lot of these back teeth, no one will ever see them, so aesthetics is not on the top of my list as to why you would do a crown on a premolar or a molar, but it definitely can be if the tooth is more visible. Now, what are some negatives? You got to know these things. Situations where don't happen often, but you need to be aware of them. And that is, you have a tooth and it's not hurting or bothering you, and the dentist and you have decided you're going to put a crown on it. We go ahead and we drill on the tooth, we do everything, and then the next day you call me and you tell me, well, doc, before you drilled on this tooth, I was fine, I was happy, but ever since you started drilling on it, now I am in pain. It was not painful before, but now it is. Well, what do we do? Once again, this doesn't happen often, but let's say in the 5% of the time that it does happen, if you leave 3 out of those 5 teeth alone, the pain will go away by himself. However, there are situations in which we have done a crown on a tooth that was not bothering you because we want to make it stronger, but afterwards it starts bothering you and we have stirred up trouble in that tooth. The nerve has become a little more inflamed, and even though we really feel bad about it, then you unfortunately need a root canal to make your pain go away. So, tooth becomes painful when it was not painful before. This does not happen often when we do a crown, and if it does happen, if you leave it alone, probably the pain go away, but you need to be aware, small chance, you're going to end up needing a root canal on a tooth that was not bothering you before. This one, we try to avoid, of course. My goal is when I do a crown, you don't even think about it. You have a tooth that's functioning fine and everything is good. But no crown is ever going to have the exact same contour that your natural tooth did. So every now and then when we do crowns on teeth that were not bothering you, because of the different contour, you end up packing a little extra food over there. Once again, we try to do everything we can to avoid this, but every now and then this happens. Another negative is there's no going back. Once you've had a crown, you've got a crown forever. Unlike a filling, where if you do a filling, you can still have another filling in the future, or maybe you can have a crown done on it in the future. You've used up all your crown cards when you get a crown on a tooth. Now, this is a good thing if you really need it, but in situations where maybe you don't need it, you may want to think about that right there. And of course, whether you have insurance or you don't have insurance, crowns are expensive, so that is another factor to be aware of before you make your decision. My goal in this talk was not to convince you to get a crown or not to get a crown, but just to make sure you know all the facts before you have one done. I hope that helps you. Once again, I'm Andrew Kokabi of Brookhaven Family Dentistry. We're a nice dental practice here right outside of Atlanta, and possibly the greatest dental office in all the world. Yeah, of course I have a biased opinion, but nonetheless, we've got a really wonderful dental practice. We've got really kind-hearted team members, hygienists, front office team members, assistants, dentists, and we've got a lot of really nice patients, and we do a lot of really cool things for our community, so feel free to check out our website to learn more. Thanks again. Hey, once again, I'm Brookhaven dentist Andrew Kokabi of Brookhaven Family Dentistry. I hope you enjoyed the video and got some good information out of it. If you did, please do me a favor and press the thumbs up button below and like this video, and maybe even subscribe to the channel. Thanks again.